Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. My name is Norsuraya Hassan and I am from University Technology Mara, Cawangan Pulau Pinang, Campus Bertam. Today I would like to present my study, and the topic is a pilot study, practice of breast self-examination and its relation to knowledge and attitude among women attending outpatient clinic in Northern Penang. So this is my presentation outline. First, introduction, followed by methodology, result and discussion, and lastly, conclusion. Okay, for the introduction. So in Malaysia, new cases of female breast cancer reported in 2003, 64% of these cases were women between the age of 40 to 60 years old, and it is the commonest cancer in female of all ethnic groups. This is from the National Cancer Registry 2003. It also the leading cause of death among women, accounting for about 11% of all medically certified deaths in the country. Hence, the Ministry of Health has promoted the practice of monthly BSE, which is breast self-examination for women above the age of 20 years, and annually clinical breast examination by medical or paramedical personnel. BSE is primarily taught by nurses to women who attend government's health clinics as well as family planning clinics run by the non-governmental Family Planning Association. However, the Canadian Task Force on Preventative Healthcare found no evidence that routine BSE teaching or practice is beneficial in terms of lower risk of breast cancer death or earlier stage of cancer at diagnosis. Instead, they found that women who were taught BSE and practice it faced a higher rate of physician visits and higher risk of anxiety and benign biopsies. BSE remains the most controversial of commonly recommended strategies for breast cancer screening, although it is a simple, non-invasive, requires little time, has no medical cost, and is intuitively attractive. Its effectiveness has not been established. So, the rationale of this study is it is very important since the research has done by Ministry of Health shown that about 1,200 new cases were reported each year. Hence, in this study, we may define the association between knowledge, attitude and practice of BSE among women attending outpatient clinic in Northern Penang. Next, we go to the methodology of this study. So, it was a cross-sectional survey of randomly sampled 71 female attendees of the outpatient clinic in Northern Penang. A self-administered questionnaire was given to each participant. The questions were designed with scale 1 to 5, which is 1 for strongly disagree and 5 for strongly agree. The question included socio-demographic data such as age, education level, religion and marital status, family history of breast cancer, and the level of individuals' knowledge of breast cancer, attitude toward BSE, and questions relating to practice of BSE. Okay. Data were analyzed by using statistical packaging for social sciences, ICSSTPR2022 version 22. The test of statistical analysis was based on chi-square value, frequency and coefficient of determination. The differences between the variables were considered significant if the p-value is less than 0.05. Next, we go to results and discussion. So results showed that 74.7% of selected respondents ever practiced BSE, but only 31% practice it on a monthly basis as recommended. Women who practice BSE were mostly never married to at least a diploma holder compared to women who do not practice BSE. Total mean score for knowledge was 3.3, and their major sources of knowledge on BSE among women were from doctors or nurses, which is 60.6%. Total mean score for attitude among these women was 2.9, where majority of them did not take any action since the breast abnormalities did not show any sign. However, 74.6% have shown that they were taught on technique to perform BSE on their own. This study also revealed that there is a significant association between education level and knowledge regarding BSE. Results also shown a significant association between education level and practice based on BSE, which is p-value 0.001. However, there is no significant association between education level and attitude, which is p-value 0.348. On determining the relationship between knowledge, attitude, and practice, results had shown that there is no relationship between knowledge and attitude, but there is a significant relationship between knowledge and practice regarding performing the BSE technique. Moreover, no significant relationship between attitude and practice where p-value is more than 0.05. Okay, for the first pie chart, show that patients respond to the question of have you ever practiced on BSE, which is 30.99%, which is 22 of the patient has performed breast self-examination BSE, 43.66%, which is 31 of them seldom do the breast self-examination, and 25.35%, which is 18 of them not perform breast self-examination. On the second pie chart is the source of breast self-examination information, which is 60.56% of the patient got their information about breast self-examination from the nurse. So, as a conclusion, even if the respondents were high educated women, they normally did not take any action toward BSE compared to those who had lower education level. For the recommendation, since the result has shown that even the women patients are highly educated people, they still need to take concern regarding their health. The nurses especially need to encourage the patient to do the BSE since the number of breast cancer cases nowadays increase rapidly. Emphasis should be laid on BSE in undergraduate and postgraduate courses, especially for nurses as they are most involved in patient education. So this is my team member, Mr. Nizwan Azman, Mr. Muhammad Amin Ahmad Zaki, Siti Munira Abdul Wahab, Dr. Rusnani Abdul Latif, Puan Nur Asma Bakar, and Mazriana Ahmad Kasim. And that's all from me. Thank you very much.